Here are my 3 audience members for my speech. The average American spends $1,200 per year on prescription medications, according to an article published by Bloomberg. Today, I will be discussing price controls in the pharmaceutical industry. Price controls are defined by the Cambridge Dictionary as a limit set by the government on the price that can be charged by companies for particular products or services. The United States government ought to put price controls on the pharmaceutical industry because price controls would increase access to medications, increase competition in the market, and they would stop price discrimination. First, price controls increase access to necessary medications. Opponents of price controls often try to argue the fact that price controls can lead to shortages of a product or service. One example that is often used is when the US put price controls on gasoline. According to a 2019 article written by Leslie Kramer, published in Investopedia, quote, price controls can also distort the effect of supply and demand on a market. Governments sometimes set a maximum or minimum price for a product or service, and this results in either a supply or the demand being artificially inflated or deflated. This was evident in the 1970s when the US temporarily capped the price of gasoline around under $1 per gallon. Demand increased because price was artificially low, making it more difficult for the supply to keep pace. This resulted in much longer wait times and people making side deals with stations to get gas. The biggest flaw with this argument is that the gas industry and the pharmaceutical industry operate differently. People don't just buy their medications whenever, they get them prescribed by a doctor. The way this works is a doctor will prescribe only a few refills of medication for a patient at a time. Therefore, because patients don't have unlimited access to any prescription drug they want, there is no reason for a shortage in prescription drugs to actually happen. Also, price controls will lower the price of medication so that low-income individuals would be able to afford their medications. Currently, low-income individuals are not taking their prescriptions simply because they cannot afford them. A quote from a 2015 article written by Steven Reinberg, published in the Consumer Health Day, reads, quote, nearly 1 in 10 American adults don't take their medications as prescribed because they can't afford to. Health officials reported Thursday. High drug costs in the United States may be hurting the very people these medications were meant to help. A new report from the U.S. Center for Disease Control and Prevention suggests about 15% of U.S. adults have asked their doctors for lower cost alternatives, the researchers found. Further from the same article, quote, the poorest adults, those with incomes below 139% of the poverty level, about 27,300 for a family of 3 last year, were most likely not to take their medications as prescribed because of limited finances, the researchers said. Because price controls would limit how much the pharmaceutical industry could charge for prescription drugs, almost 33 million more Americans would be able to afford their medication. Second, price controls would increase the competition in the pharmaceutical industry. Some people try to argue that price controls are not necessary because competition itself lowers prices. Paul Howard writes in a 2015 article published by the New York Times that, quote, getting more drugs to the market means more competition between producers. As we've seen from new medications combating hepatitis C, the emergence of multiple drugs have helped insurers negotiate up to 50% price cuts. The problem with this argument is that it actually proves that price controls would lower the cost of drug prices. Using this logic that competition leads to price cuts and the fact that price controls lead to competition, it can be seen that there's no reason to oppose price controls. Currently, pharmaceutical industries is run by big corporations. Price controls would limit the profit of these larger companies so smaller companies can enter the market, creating a more competitive market. Large companies currently use a variety of tactics to ensure that there is no competition. A 2017 article written by Aaron Fox, published by the Harvard Business Review, says, quote, the system intended to reward drug companies for their innovation, but eventually protect consumers, is systematically being broken. Drug companies are thwarting competition through a number of tactics and resulting in high prices, little to no competition, and drug quality problems. One way branded drug manufacturers prevent competition is simple: cash. In the so-called pay-for-delay agreements, a brand drug company simply pays a generic company to not launch a version of the drug. The Federal Trade Commission estimates that these pacts cost U.S. consumers and taxpayers $3.5 billion in higher drug costs each year. Citizens' petitions offer drug companies another way to delay generics from being approved. These ask the Food and Drug Administration to delay action on pending generic drug applications. By law, the FDA is required to prioritize these petitions. However, the citizens filing these concerns are not individuals, they're corporations. The FDA recently said that branded drug manufacturers submit 92% of all citizens' petitions. Many of these petitions are filed near the date of patent expiration, effectively limiting potential competition for another 150 days. With price controls in place, large companies would not have the resources to have complete control over the market. Smaller generic companies would be able to effectively compete in the market and would have more say. And using the logic of the opposition of price controls, more competition in the market means lower prices for consumers. Third, price controls would stop price discrimination. Many people try to argue that price discrimination is okay because it's necessary to cover the cost of research and development. According to a 2012 article written by Shira Bhanji, published by the Harvard College Global Health Review, quote, "One of the primary reasons for price discrimination is the astronomical cost of drug research and development. The average cost of developing a new drug is more than $1 billion over the course of 15 years of research and testing. Many drugs fail in clinical trials and don't even make it to the market, resulting in sunk costs." One reason this argument is flawed is because that even if prices need to be high in order to cover the cost of research and development, it is ethically wrong to charge one person more for the same drug. Moreover, because price discrimination causes drugs to be unaffordable to a lot of people, less people are able to buy them, and that in turn means less profit for the companies to use to cover the cost of R&D. Price discrimination is used to vary the prices within the United States. A quote from a 2018 article written by Katie Thomas, published in the New York Times reads, quote, "Some disparities obviously result in the higher cost of living. New York and San Francisco were the most expensive cities in the country for drugs. But prices can vary widely even between similar cities in the same state. Cleveland's pharmacy prices were 2.5% above the national average, while not far away, Columbus had prices that were nearly 22% below the average. In Cleveland, the generic version of Paxil, an antidepressant, costs about $46.94, while in Columbus, someone would pay $20.87. Currently, the United States pharmaceutical companies can charge unfair prices because there is nothing in place to stop them. Price controls would effectively stop this. To conclude, the United States government ought to put price controls on the pharmaceutical industry because price controls would increase access to medication, increase competition in the market, and would stop price discrimination. As Dr. Paul Farmer, the chair of the Department of Global Health and Social Medicine at Harvard Medical School, once said, quote, "It is clear that the pharmaceutical industry is not, by any stretch of imagination, doing enough to ensure that the poor have access to adequate medical care."